Okay, so I want to talk about a lot of it comes down to the eyes. A lot of times it comes down to how they move. I'm going to teach you some gait stuff as well to look at, but um, consistently over and over and over again, what I will see when a child has an asymmetrical tonic neck reflex is they cannot track their eyes from side to side efficiently. You'll see skips and jumps in their eyes, or what's called saccadic intrusions. So when we pursue, we should be able to follow nice and smooth. Really, after pretty much after like two, you should have some really smooth eye tracking pretty much. There's obviously some variation there, but you shouldn't see big jumps and skips in a child's vision as they're trying to follow stuff side to side, up and down, or with convergence. So when I see skips side to side, I'm starting to think about an ATNR. Also, if they can't fixate their eyes and move their head independent of their eyes, again, I'm also thinking of an ATNR. So, like for example, let's say you're having them follow your finger and their whole head is moving. That tells me they don't have the ability to use their eyes independent of their head. They will have an ATNR. Pretty much every time. Then if you see those big skips, like let's say you hold their chin still and you have them track and you see those big jumps and skips, then also I'm thinking of an ATNR. And then there's some other stuff you can do seated. Like, for example, a lot of times I'll have them turn their head and I'll look to see if there's more resistance straightening this arm than there is this arm. Because when they truly have the reflex, if they turn their head this way, this side wants to extend and this side wants to flex. So I'll just turn their head and I'll see, is there more resistance here than there is here? Or vice versa. Is there more resistance here than there is here? Same with their legs. You'll see the same thing. So when you turn their head this way, this arm is going to want to extend, so also means their right leg is going to want to extend and their left one's going to bend. So is there more resistance in their body from side to side when that's going on? Also, many times with an ATNR, they might have more difficulty crossing midline. Something to always think, if a parent's like, hey, my kid, if it's on this side, they only use their right hand. If it's on this side, they use their left hand. So they become more, I'm going to blank on the word, but ambidextrous? However you say that, they can use both their hands equally. It's because a lot of times they don't learn to cross midline. So when it comes to the symmetrical tonic neck reflex, what you'll see in the eyes is difficulties tracking up and down. So again, we want to see this pursuit system developing, or ability to pursue smoothly, but what you'll see is these big jumps and big skips up and down. They can't efficiently track up and down. But a big key is I have never seen a kid that has a convergence insufficiency that doesn't have a symmetrical tonic neck reflex. So if you bring your finger into their face and they start converging their eyes, but then you start seeing one of their eyes just drift off, that's called the convergence insufficiency, where their brain it's either they don't have enough stability in their eyes to bring their eyes in, and it drifts off and it'll come back and drift off, come back. But what happens when that's going on is they're getting double vision, single vision, double vision, single vision. Or their brain sometimes will just completely suppress that eye and will shut that eye off. And so their brain shuts it off. Their eye's still open, but their brain shuts it off. It drifts off and they go, no, I just see one, which I'm going to teach you how to assess that. But again, that's another really common thing we see with the symmetrical tonic neck reflex. Also, there's something called ocular suppression, which I'm going to show you how to use a chart for this, where basically the brain shuts off one of their eyes when they're reading and learning because they get double vision otherwise. And then there's a test called a cover-uncover test, which is a great test to look at ocular alignment. And when this is going on, typically they'll have an ATNR and STNR. So what you do is you have them you sit in front of them, have them look right at your nose, you cover one of their eyes, and then you switch quickly and switch back and forth. You shouldn't, if they're looking at your nose the whole time, you shouldn't see any eye deviations or movements. But what will happen is, like, let's say you're looking here and then you switch. What a lot of times you'll see is this eye will jump in really quickly or jump out really quickly, because as it switches back and forth, their eyes aren't perfectly aligned. So you're seeing them jumping back in, out, where they should be stable all the time. If there's an alignment issue, then you'll see them popping in and out. But if their eyes are good, you won't see any movement. So just FYI there, it's an easy way to look at that. Okay. So when we look at range of motion, like head, neck range of motion, left or right, if there's a lot of restriction in their head, left to right, typically there's an ATNR. If there's a lot of restriction up and down. Many times there's symmetrical tonic neck reflex or a tonic labyrinthine reflex or a moral reflex. Another thing to think about as I'm talking about that, like this up and down range of motion, if they can't tuck their chin back, a lot of times they have a tongue tie and breathing issues. So again, that comes back to the oxygen thing we were talking about earlier. If the kid's standing and you start tipping their head back and their shoulders come up like this, that's very, very common with a moral reflex or a startle reflex. So that's another good way to check that. Like if you don't want to go and pull the kid back or drop them back quickly and startle them, you can just simply tip their head back and they'll start taking this big inhalation in and their shoulders come up. That's again, that's positive for a moral reflex. Another one is if a kid's standing in man's position or that sharpened Romberg's where they stand one foot in front of the other one. In neutral, their head is like when their head's in a neutral position, their eyes are closed or open, their balance is really good. But then we start to tip their head back and their balance gets really challenging. We're thinking a moral reflex, tonic labyrinthine reflex, or something with the posterior canals of the vestibular system, which I'm going to teach you about. Every other test you can typically do, like, severe autistic kids, I can check their palmar grasps, their rooting, their, Babinski's, spinal gallant, those types of things. But when it comes to ATNR, STNR, Moro, TLR, those can be a little bit more tricky. But these are some of the clinical things that I use to help me isolate that in or out, and know if they're there or not is based off of, what we're seeing there. Okay. So I want to break this down in as simple of a way as I can. When a kid still has a lot of primitive reflexes, I want to make sure that I'm looking at the brainstem. And when we're looking at the brainstem, we're really looking at cranial nerves. And because all these cranial nerves come into our brainstem, and so knowing how to do a good cranial nerve exam is really beneficial because it helps you understand where the weaknesses are. And wherever you find weaknesses, those are areas to stimulate. So this is like the most simple way of thinking about functional neurology, and this is how Dr. Karazian puts it, and and Dr. Brock as well. Whatever your finding is in your exam that's abnormal, you can rehab it by doing a lot more of that. So, for example, let's say we're looking at the vagal system, right? And let's say their left eye constricts really nicely, the right pupil is larger and it doesn't constrict as well. And then, like for example, let's say you go and they elevate their palate, and their left side elevates really well, the right side doesn't. They don't have a gag response on the right. Their left side, they do. Well, you could do activities where they're gargling more on that one side, or maybe you have them put something in their mouth where they gag every once in a while to activate that vagal response. And you put a light in their right eye to start getting constriction of their pupil. You can use all of those different modalities to start activating that system if you know that it's weak. But my favorite things to look at are facial tone, facial symmetry, pupil response bilaterally, elevation of the palate, gag responses for vagal activity, because that vagus nerve is vitally important in all of these kids that are struggling, especially if they have anxiety, constipation issues, just overall brain development. I mean, the vagal system helps calm our immune system, helps push, activating it has been shown to push blood flow to the brain, helps get blood flow to the gut, like function of the gut. It's a really important system. But I found this, I actually really like this. It's a real easy video here, and you can watch this of how to do a cranial nerve assessment. I don't want to waste your guys' time here, but it's about a 10-minute video. I shouldn't say waste your time. Really important. Watch the video. I'm going to go on to other more important that I think are a little bit more important, but please watch this video because it's a really good, easy exam. Explains cranial nerves really easy. But I'm going to go back to what I actually look for. So facial symmetry and tone. I want to see that both sides are symmetrical. So like, for example, if a kid has a rooting reflex, the musculature of their mouth is not developed. You might see it on one side more than the other one. And the reason why they have it is to try to stimulate that tone of their face. Like kids that aren't speaking, a lot of times because they don't have enough tone in their face, they don't have enough connectivity between their musculature, their mouth, and their face and their brain. So we want to increase that. So if a kid has less tone on one side, I want to get more tone on that side. So I might have them, if they're cognitively able to, I might have them do winking on that side, smiling on that side, chewing on that side. If they're not old, well enough to do that, I might use a Resimax to get sensory feedback to the side, or I'm probably gonna either do that either way. But I might use a stim pod to activate those muscles, which is a radio frequency, or you could use a TENS unit to activate those muscles, or you could use you could even just do deep pressure and rubbing and trying to activate those muscles manually. Or if they have that reflex, you're just going to stimulate it, because every time you stroke their face, they reflexively move. They're activating that on their own. So we're going to use that to start building that tone in their face. But also, if they have really low tone, they probably never developed those reflexes appropriately, like the rooting reflex or a snout reflex or something like that. So you can check those. Pupil response. This tells me a lot about the balance of their parasympathetics and sympathetics. If they're really sympathetically dominant, their pupils are going to be dilated all the time. Then when you go shine a light in their eye, they'll constrict, but then they fatigue out. So I want to look at that. Number one, is there an imbalance? One side larger than the other side. Do they both respond to light appropriately? And then how quickly do they fatigue out? And so when they fatigue out, what happens is they constrict. They should be able to hold that. If they have good parasympathetic tone, they should be able to hold that. But when they're in a constant state of fight or flight, their pupils are always dilated. Therefore, they never develop the ability to constrict well. And as they constrict, if it starts blowing out again, it tells you about the fatigability. That person's going to be anxious all the time. And then also, if you see one pupil that's much larger than the other one, start to think about a convergence insufficiency on that side. Because when we converge our eyes in, our eyes come in, but at the same time, our pupils constrict. So if our eye can't come in, this eye is constantly constricting. As it comes in constricting, this one starts constricting, but then probably fatigues out, and now they don't get enough activity. So it's kind of like me always doing bicep curls on this side, but never on this side. I'm gonna have a much larger bicep or a much better constriction on one side than the other side. So that's why you're seeing a larger pupil. So watch out for that too. It may not be brainstem related. It may just be, well, I shouldn't say that. Convergence issue is brainstem related. It may just be because they're not converging enough, not because the pupil or that balance of that parasympathetic to sympathetic. So, and then one of my favorite tests is looking at the palate. So you look in the back of their mouth, you have the arches that come up, then you have your uvula that hangs down. So for example, if I open my mouth and I go, and this side elevates and this one doesn't elevate as much, then that we're not getting enough tone there. And when you look at a person's palate, it's important to not only look at it, number one, but you have to have them activate it. So, because for example, I could have a lower palate on this side due to my facial structure that didn't develop the same on one side and the other one because I chewed more as an infant on one side, or whatever it may be. But then you go to, and this side elevates, but this one doesn't. Well, this side's the problem. So we want to make sure that we're looking at when it elevates, what happens. And then also, I like to check a gag response. So I'll take a long Q-tip and I'll touch the tip of their tongue. Because some people just touch the tip of their tongue, like, they have a really exaggerated response, right? So we want to make sure we don't just go back and just make them throw up all over the place. So start on the tip of their tongue, just work your way back, maybe 3 or 4. And then I'd touch the back of their throat. And they should gag. That's a normal response. Their eyes should water, all that stuff, both sides. And I always just tell them, this is the worst thing we're going to do. And I just touch real quick. Some of them don't even gag. They're just no gag response at all. I'll go to the other side and they have a severe gag response. Or bilaterally, they don't have a response. That's when I know, hey, their vagal system isn't functioning well. That should be a quick response. And so that way they don't choke on stuff. And it's a survival mechanism. So, FYI, all the other tests in here are great. Looking at that Merck manuals, it's a quick 10-minute video. Talks you about how to assess all the different cranial nerves really quickly, acoustic ones, your eye tracking ones, your vestibular, where that comes in. So just a nice quick little review for you guys. And looking at them is important. I would say I don't check all of them on most kids, just simply because a lot of them are, I'm not going to get a consistent response. If I go, let's say I'm checking Weber and A, like I'm not going to get probably valid information back from that on a kid that's, autistic or having delays. So these are the ones that I found to be the easiest to assess, that I can assess on pretty much every kid. But the other ones, if I can assess them, I do. But for a lot of our patients, I just don't have the ability to do that based off their cognitive abilities. So thanks for taking the time to check out this video. To learn more or to schedule an intensive or anything with my team, there's a link below. Just go ahead and click that and that'll get you to the right spot. Have an awesome day.